Hey everybody, in this video, we're going to talk about vaginal collapse or prolapse. I'm Dr. Diane Mueller. I'm your libido doc, and we talk about all things libido, sexual health, relationships, and more on this channel. So what is a vaginal prolapse? So a prolapse is where tissue basically moves to an area where it's not supposed to be. So in case of a vaginal prolapse, one thing that's important to understand is a lot of people don't understand that the vagina is actually just one portion of our genitalia. It's actually the tube that's inside, and then of course we have other components of it. We have glands, we have the clitoris, we have the labia, the lips, we have the opening. So the vagina is just the tube that's actually inside of our genitalia, and it can actually move and fall. Other things can happen. Other things can move and fall. Our uterus can move and fall. Our bladder can move and fall. And what happens when we have this, say, dislocation of these tissues and organs really is that we can feel a sense of fullness in our genital area. We can feel a sense of urgency. We can have changes in our need to defecate. It can create pain with sex, discomfort, urgency, frequency, a lot of other things in this particular region. So what do we do? Well, one of the things to understand is there's a reason why this happens. And for many people, for many women, it's post-pregnancy, it can be post-trauma, it can be post-car accidents, it can be to infections of all different types. So there's several things that can actually lead to a prolapse, and it can also just be a part of the aging process if this tissue is not taken care of. So we want to make sure we're really strengthening the muscles of our pelvic floor. The muscles of our pelvic floor sort of sit like a hamstring, holding up all of the organs and all of the tissue above it. And so these muscles, when we strengthen and tighten them and we allow them to move properly, that actually helps to hold the organs and tissue in place. And due to aging and not strengthening these muscles, like most of us don't go to the gym, right, and think like, oh, I'm going to work my pelvic floor muscles. We go to the gym and we work our biceps, our quadriceps, these sorts of things. And what happens with age, because most of us have not spent a lot of time strengthening our pelvic floor muscles, teaching them how to both strengthen and relax. So contract and relax, which is what proper muscle tone needs. And due to aging or due to childbirth, where they're almost in sense hyper relaxed, right? They're overstretched with childbirth. We need to do things to actually tighten and hold them back into place. So there's a couple different exercises that have been talked and used for this. One are Kegel exercises. The other are jade egg exercises. And from what I've seen and the people that I've interviewed in the Kegel and the jade egg world, there's this huge almost like fight between Kegels and jade egg exercises. So let me tell you a little bit about them both. So Kegels are essentially where you're going to squeeze your muscles, and you're going to squeeze not just the muscles like the muscles that are used to urinate or stop pee, but also the muscles that are used to, say, squeeze and prevent a fart from coming out, essentially. So your muscles of defecation, right? So these are all the muscles both in the front and the back of your pelvic floor. You want to make sure you get them all. So when we do a proper Kegel, we're really engaging all of these muscles. Now, jade egg exercises are when you're going to get a jade egg, literally like a gemstone egg, and the proper jade eggs have a hole in the middle of it, so you can actually put a string attached to the jade egg. You can use dental floss or a string. That way, when you insert the jade egg intravaginally, which is how this exercise is done, you have a string hanging out like a tampon. And when that string is hanging out, essentially what that string is designed to do is to allow you to pull the jade egg out easily without getting it stuck. Just make sure you tie the jade egg real tight so that string doesn't come undone. So essentially with jade egg exercises, there's different talks of how you can do jade egg exercises online. And the one idea is you just basically put the jade egg in, you go about your day, you do your dishes, you just do normal stuff, causing your body to contract around the jade egg. So one of the problems, one of the fights between the Kegel predominant people and the jade egg predominant people really is this conversation of how muscle actually works. So the jade egg people, one of the things that the jade egg community will talk about is with the jade egg and that string hanging down, you can actually put weights on it, and so you'll be contracting like you're lifting weights. So the theory with the jade egg is like, we would never go to the gym and hold and basically do bicep curls without a weight, right? So with the jade egg, the idea is, hey, you want to work out these muscles, you want to use a weight. The Kegel people and the Kegel component of things, it says, well, you would also never go to the gym and just permanently put yourself in a bicep curl and walk around like that for 20 minutes, right? You would contract and you would relax and contract and relax. So oftentimes the argument on the Kegel side is, hey, we need to make sure we are doing enough relaxing because that's how the muscle works properly. And we do see that proper muscle function works when you're both contracting and relaxing. So from that standpoint, what I like to talk about is kind of combining these theories. And whether you're doing Kegels or whether you're doing jade egg exercises, the biggest thing you want to consider besides engaging all of the different muscles of the pelvic floor, both the muscles of urination, the muscles of defecation, besides engaging all of these muscles, you also want to make sure you're relaxing. So if you're doing jade egg exercises, one way to work with jade exercises, which I find to be very useful, is to use the jade egg, but to use the jade egg to actually insert it in the shower so you can have this sitting in your shower. And just at the end of the shower, insert the jade egg, have weights hanging from it, and then contract, and then see how relaxed you can make yourself. Contract and see how relaxed you can make yourself. And that's basically mimicking what we're doing at the gym, the contraction and the relaxing. And just like at the gym, you might do a set of 10 contractions, for example, and then 3 sets, right? So essentially, maybe you do 10 on, take a break, 10 on, take a break, 10 on, take a break. And that way you're really working the muscles. Now, one of the things that can sometimes happen is when these muscles have been not used for a long time, it's almost like the brain has a hard time finding them. So if you're finding wow, you're trying to contract and you're trying to find these muscles and you're like, nothing's happening. Another thing you can do is you can lay down, and if you insert 2 fingers intravaginally, and then you move your windshield wipe your feet. So you move your feet in and out like this while your fingers are inserted intravaginally. And what this does is this allows your body to begin to essentially feel the movement of some of those muscles. When your body begins to feel, if your brain's had a hard time finding those muscles, contracting them, this helps make that neurological connection between your brain and your muscles again, which allows you to have more ability to use those muscles and find them and use them appropriately to do these exercises. So make sure you consider all of these things. Always make sure you consider your structure, making sure your spine is straight, consider working with a chiropractor, making sure your pelvis is alignment, because all of those things can make a big difference. Water, hydration, minerals are also really important things. So if you want to learn more about this and more of what I do and how I help women with all sorts of problems that are related to sexual and genital health, as well as relationships, love, lust, libido, please find me in the show notes. I have information about master classes as well as other ways of working with me. All right, everybody, see you next time.